Welcome to this longer demo of the tool that we built for our SNOMED 2022 Expo session. Less is more use case driven terminology implementation. Aligning with our larger vision as a company, we're here proposing an approach to help organizations reduce the noise that terminology can generate that. We do this by using less terminology rather than more terminology because for a lot of use cases, many of the codes available and many of the terminologies that are relevant are actually not needed to support that use case. So by reducing the search space and the problem space effectively, we can focus the attention more on what information we're trying to capture for a particular use case than what terminologies are needed to support it. And COVID offers an interesting and informative case study in this because there was a need to develop a lot of content standards quickly around how to use COVID for many public health reporting use cases, and also just trying to get a handle on how to deal with it, how to report tests properly out of labs as there was rapid development of testing protocols and vaccines and things like that. So what we're going to do is take a deeper look through the tool here that we've set up and go through each kind of case and talk through what's here and how it was implemented. So to start here, go to covid.terminology.tools and you can do this yourself. You get to this landing page, which just has some other information, but really you can jump right in by clicking Start Browsing. So we've got 5 terminology kind of mini sets loaded in based on the content that was specifically relevant from these 5 terminologies. So CPT, CVX immunization set from FDA, ICD-10 CM, the clinical modification in the US, LOINC, ARCStorm, and SNOMED. So clearly this is US focused perspective, driven kind of by all of the work that was done to create standards around use of healthcare terminology for COVID over the last couple of years. So we'll go through kind of each of these cases, starting with CPT. In particular here, there was a document published by the AMA regarding guidance around CPT coding. So what we've kind of done is scrape this website and produce a rendering of the content that's mentioned in this document here. And so if you click on this subset, you can see the codes that actually resolved in the data set that we had. And these are effectively codes that are related to COVID from CPT. Clicking on one of these, it'll load the concept in the section below here, and you kind of see more information. Here, CPT is loaded from the UMLS. There's not very many codes here, just the ones that are kind of relevant for CPT itself. And you've got the information as the UMLS presents it. And here you can see a link back to the coding and guidance document that this content came from. The one other thing we see here is WCI computed content. So we undertook an effort to identify mappings from SNOMED to CPT, and where SNOMED codes were included, which we'll look at a little bit later, we picked them up also. So this is just a representation of how other content that may not specifically have been called out by the organizations that curate these terminologies may be relevant for the use case. So an exploration into kind of the linkages across terminologies can be done to pull additional content into scope. So here we have a number of other codes that are not actually specifically mentioned in that coding guidance document, but which are relevant because of their association with content that was specifically mentioned for use in COVID in other terminologies. So next, we'll take a look here at CPT. This is really just the COVID vaccines that, so this links to the master document of vaccines, but is effectively a list of the COVID vaccines for use in the US and the codes that go along with them. Very simple, vaccines are approved. This again is US jurisdiction, but a similar sort of thing could be done in other situations. And this does include some inactivated or retired codes as well. And similarly to the CBT thing, you can click on one of these codes here and find more information about the vaccine. CVX is really a very flat terminology, no hierarchy, just individual codes with names of the underlying vaccines that are involved. So this is a very simple perspective and a very simple terminology. Here, if we searched everything, you'd see there's only 157 codes loaded in its entirety. Next, we can take a look at ICD-10-CM. This gets a little more interesting. There's a lot of data sets here. If we expand this, we can see the full set. So we've got some WCI computed content here as well. This again is because we're picking up SNOMED codes for a variety of reasons and then following the maps to ICD-10 codes. So this represents a set of content that isn't included in any of these other sets, but of which might be considered relevant for COVID use because of its connection with the SNOMED content that was included for various reasons. Many of these other things are actually linked to the VSAC, which is a value set service run by the NLM. This takes a little while to load, but we'll give it a chance. And you'll see that other users working in a standards context have defined, in this case, a provisional set of ICD-10 codes that represent confirmed COVID infection. In this case, there's only one, which is the emergency use code. And if we look down here below, you'll see that is in fact the one code that's here. So let's take a look at another one. Suspected might be a little bit more interesting. Although actually, yeah, so this has 13 codes in it. So what we've done here is essentially pull the content from the Value Set Authority Center application, which lists these codes here, and then implement this in a terminology server environment with an API so that one can directly access the 13 codes that are involved and defined by this value set. This represents a kind of interesting opportunity where this entire environment we're looking at could actually be programmatically built from value sets or subsets that were maintained in an external resource. You know, an integration could be created that would actually dynamically pull sets of potential content to import and then literally make a call to pull in those concepts and then make them available in this terminology server environment so that you could build up the content, not as we did, which was by kind of manually downloading these sets and curating a master set that we built the whole thing from, but you could actually go and dynamically fetch and bring in content that matched exactly the set of things that you wanted to work with. Here, if we click on one of these things, similarly to the other environments, it loads this concept below. And then here you can see all of the subsets that this participated in. So each of these are documents from various different authorities that have defined content that is relevant for COVID for a number of different use cases. This could be further targeted to represent just very specific technical implementations of standards that are out there in the use of COVID, or in our case here, we've kind of gone broader and tried to find many resources that link. And here again, we've linked back again to all of the actual source materials from which all of this came. So that's a look at ICD. LOINC was used primarily or importantly in the US in this LIVID use case, which was about creating content for labs to report consistently regarding testing around COVID. So obviously, this is a very relevant case if you want to collect information from public health contexts about what's going on. So these are various lab tests for looking for COVID in a variety of different ways in order to confirm a COVID diagnosis. Similarly to the other terminologies, you can click on this and come down and see, in this case, again, LOINC was loaded from the UMLS, so we have the hierarchy that's represented here. And then from this, you can sort of follow the chain to the various parts that are used to define this. So we can broaden the scope from just the set of codes that was included in this LIVID specification to include the supporting codes that are needed to properly render the full view of LOINC for programmatic use cases. So we can sort of join back all of the tests that look for COVID in a particular way and that sort of thing. And you're welcome to kind of explore this content as well. Here, we've got a number of sets available, and you can search across the members here as well if you want to kind of tune that down. Next, we have ARC-SNORM. So this is medications use case. So here we've got vaccines and medication codes produced by NLM that represent the actual ARC-SNORM content. Right, so part of what we're after here is, what you can see here is essentially a website that lists a number of codes with some information, but this is not a technical implementation of the set of codes. And so it may be important to instead be able to work with this programmatically. So we've pulled this set in here, and these are actually now ARC-SNORM codes that are available through an API and linked to the larger graph of ARC-SNORM content that represents this. So you can see the whole sort of space neighborhood around this specific code that was chosen, and what all of the different pieces of it are in the model of how ArcSNORM represents drug information. So this kind of walking the graph to pick up additional information is a key part of what we've done here, because it enables not only the list of codes that's in the specification, like this one here, but the supporting neighborhood of content that's needed to fully programmatically interact with these codes can also be computed and then also loaded into the environment. So this is a perfectly good example of that. If we were to look at these various codes here, they would likely not participate in any of the subsets that were the reasons why, the drivers of how this content was created. And then finally here, we can come look at SNOMED. I actually, in ArcStorm, there's also some content here. This is looking back, we curated some content. So in our own work with various customers, there were reasons why people wanted certain ArcStorm and SNOMED content to be tagged as being COVID relevant. So this just demonstrates that for your own personal use cases or internal use cases, you can go beyond the published standards by the terminology providers about what codes are useful and bring in your own, because these may be things that you want to track or customers want to track, or are relevant in exploration of patient cohorting or data health records to understand the relationship of treatments that might be out of scope of those other lists, but are still relevant. So, in addition to being a technical implementation of published lists of codes by, authorities out there, it is possible to combine that with internal code lists that represent additional information that may go beyond the specifications for really tuning the use cases, specific needs that are required. And this curated content really covers, in our case here, content in ArcStorm and content in SNOMED. So if we come here, there's a curated COVID content set here for SNOMED concepts that go, again, these are a set of codes that go beyond the sets of codes that were described by other organizations to represent SNOMED content effectively for COVID use case. Here, there are many different subsets that are available, and you can sort of look through across them here. We'll go take a look. SNOMED published this document coding COVID-19 related data in a specification on the Confluence wiki. And this gets into another perspective here. So what they've published are sets of ECL expressions that go into the details of the codes that should be involved in these different categories of provider and facility details. So healthcare profession, site of care, health management finding, and so on. So one of the things that we've done is take this specification and then actually execute these queries and pull in the list of concepts that are involved. So when you do that in the environment here, you'll see that this actually becomes quite a lot of codes, 1,550 codes. We broke this down at this level of 2.1 here. We could have broken it down further at the individual levels. So had a category for just healthcare occupations, but just to kind of keep it manageable and a little bit simpler for demonstration purposes, we combined all the content on each of these 5 pages here into their own sets, which are represented by these things here. And so you can kind of investigate this and see that there's quite a lot of content across the scope of thing, including content from the set itself, healthcare. So this concept itself, we included also since it's mentioned on this page. And we could see that here if we look for it. Healthcare professional. So this and all of its descendants are going to be included. So you can find all of these concepts below here are as well included because of their linkages to the SNOMED document that described specifically how to use COVID. There's one other use case that's specifically interesting and worth talking about, and it is the creation of custom content or extension content. So one of the things we did was essentially create a concept to represent COVID toes. So, in this case, having a skin rash of the toe in conjunction, concurrent with having COVID. So more colloquially known as COVID toes. And so we didn't find this content specifically in SNOMED. So we thought, okay, this is a great opportunity to model how one could actually create extension content for SNOMED, incorporate it in this tool. This is sort of akin to the use of local subsets of SNOMED and ArcStorm concepts that might be relevant. So really, like, putting this all together in the context of COVID, what we've done here is look to broader authorities that defined sets of content that were relevant for use cases around interacting with COVID content. and we did a technical implementation of those things. Then we looked beyond those things to find the supporting set of content, and we included all of that as well. So in the case of the SNOMED set, we ran the SNOMED subontology generator to create a set where all of the SNOMED concepts in the set are logically classifiable so that use cases that need that can leverage the actual formal definitions in SNOMED as part of the work of this tool. We then said we could go beyond that and curate additional or compute additional sets of codes that are involved or relevant for COVID to kind of broaden the scope. And then additionally, just include content that was curated for an extension to go beyond even the sets of standard terminology codes. So this approach of saying use less is more, right? So in the total scope of SNOMED here, we're only using 6,000 of over 300,000 concepts in SNOMED to represent all of the content that's discussed as being COVID relevant, as well as all of the supporting content and all of the additional curated content. This makes the search space for this use case dramatically smaller, allowing humans to more easily find and focus on the content that's relevant for what they're trying to do, and also for computers to work with and more efficiently access codes. And then the supporting definitions to programmatically look across data and answer use case driven questions that this data is intended to support. If you're interested in this, please come to this tool, and we're going to keep this up and running for a while. It's available. You can just browse around and take a look for yourself at what's in here. We're happy to answer any further questions about how we went about doing this. Please reach out to us at info@westcoastinformatics.com. And understand that COVID here is really just one example of many potential use cases where we could create custom tailored sets across terminologies, but which are scaled down to meet exactly the needs of, let's say, a mental health care data set, or even a social determinants of health data set, things like that, that allow users to interact with terminology in a more focused and targeted way to reduce the complexity, reduce the time to build and deploy, reduce turnaround cycle for curated content, and ultimately make it easier to implement solutions around these targeted use cases that are terminology enabled and support the underlying standards. Thank you very much for watching this presentation. We appreciate it. Thanks.